Abigail. Nice to see you again.
Hi, Nina. Great to see you again. Thank you so much for having me.
Yes, absolutely. Thank you for being here. Um, it was amazing kind of having our conversation yesterday for Women's Health Tech Wednesdays. So now excited to kind of keep the conversation going. And maybe kind of we'll keep it short and sweet, a nice power 10 minutes. So I think, a great place to start would be, love to share if you could share a little bit more around your insights in investing in women's health and really where you kind of see the thesis going specifically at Merck when it comes to investing not only in women's health, but I would imagine healthcare more broadly that affects women.
Yeah, definitely. So I guess in general, as we start to think about the role of women in society, I think it's pretty apparent, and we can all agree that women play such a meaningful role both at home, in their communities, and also in the economy. But we talked about this a little bit yesterday, but I read a stat that really blew my mind that women spend 25% time in poor health than men, which means that the average woman will spend about 9 years in poor health. And then if we think about the implications of this on society, that affects not only her, but her ability to be present and productive at home and in the workforce and in the community. So I think for me and just in general for society, we need to really recognize that healthy women mean a healthy society and that closing this women's health gap can have a huge ripple effect. So if we think about, women can participate in the workforce, they can earn a higher income, they can lift their families out of poverty and allow more women to provide for themselves and their families. I think, it clearly is an area that deserves more investment and also deserves more awareness. And so that's why I think that we need to invest more in solutions that address this gap in the specific areas where there are big disparities, which we're seeing is like the lower effectiveness of treatments for women. Women receive worse care delivery, and there's also just not as much data for women as there is for men on kind of how treatments work for us, different diseases that women face. And so being able to close that gap is really important. And so to me, I think, raising awareness about the different challenges that women face in their healthcare journeys is really the first step to kind of addressing this healthcare gap.
Mhm.
And then I think, companies like Merck GHI or a lot of the participants here in HITLAB are doing a lot of work to raise awareness and then also develop solutions and give funding to some of these areas that are so important to, close the healthcare gap for women.
Absolutely. That is definitely a rallying cry if I've ever heard of one. That was like so beautifully comprehensive. Thank you so much for sharing that, Abigail. And I think on that note, are there any kind of key areas within women's health or healthcare that you are kind of seeing that you would think warrant greater investment and intention, either just through your experiences at Merck or just more broadly as you've kind of just been seeing the landscape overall?
It's such a great question. And I think, it's such a broad category, women's health. And usually what first comes to mind is reproductive and maternal health. And obviously, this is a huge area. And, we really do need to focus on this, especially since the outcomes that we're seeing today are still pretty disappointingly poor. But we also do need to remember that women's health encompasses not just maternal and reproductive health, but also just general conditions that may affect women just differently than men or disproportionately. So for me, number one, I would love to see more of a focus on reproductive and maternal health care, especially in the US. I think one stat that I read is that 4 out of 5 pregnancy-related deaths are preventable. And so
Wow.
there's obviously a lot of work to be done and a lot of tools and funding and research that we can be doing to kind of get our outcomes on par with where we should be as a country. And then the second area is I would love to see more awareness of how general conditions can affect women differently than men, and then a
Mhm.
focus on more women specific general health conditions like cervical cancer. So making sure that we have the funding going to those areas and the research to make sure that we can understand, what the situation is and then what interventions can be used to close these gaps.
That's incredible. And I think on that note, can you share if you have any a specific successful initiative, program, success story that you have where you were able to see kind of this positive impact through the investment, through kind of your engagement in a portfolio company kind of come to life?
Yeah, it's a great question. So we have one portfolio company that is in the social determinants of health space. And what
Mm.
they're able to do is connect social care workers. So, that's if we think about kind of like services for homeless people, kind of services that connect people with jobs, food banks, shelters, that kind of thing, with healthcare providers, so that when a patient comes into the doctor and they may need some support outside of what the health system can provide, the doctor can connect them with the right kind of social care service. And so one area that this company is working on is how do we address the screening gap for triple negative breast cancer in underserved communities. And so what they're doing is they're working on providing sort of more education and resources to improve the screening rate in these areas that are historically underserved and have higher prevalences of breast cancer, but don't have the screening required to kind of identify these cases early and provide the resources that are needed. So, that's just one example, but I think there's so many opportunities out there where we can kind of identify the gaps. And oftentimes there is a simple solution that, we can deploy through technology or a program that can have really, really important impacts.
That is incredible. And I think on that note, as you're really speaking about the power of accessibility, right, as you're thinking about some of these more smaller communities where healthcare may be a little bit more restricted, kind of wanted to ask you if I could make this very, very broad, but in your view, what role kind of do policymakers, providers, organizations, communities, all kind of this collective can really play in advocating for increased investments in women's health? I think just so curious to see your take, kind of thinking more holistically or broadly.
Right. It's a great question. And I think, there's a lot of different answers, but the simplest one is that I think these are kind of the key decision makers, and these are the groups that are deciding where funding goes and which initiatives get supported and where resources are deployed. And so I think obviously we'd love to see more awareness of what these issues are and making sure that we can get key stakeholders in each of these groups and playing the role of education and identification of interventions that work. And then once we're able to do that, hopefully we're able to find more funding and kind of give resources to these areas, and really just drive that awareness, and making sure that the resources are going to the right places. And then I think another important piece that we forget is tracking outcomes. So making sure that, if we're deploying funding and resources to this area, did it work? Did we see positive outcomes? Can we replicate this? Can we scale it? So really making sure that it's not just a, one and done solution. It's something that can be replicated and scaled across other communities and potentially other problems. And then I think in terms of, making those solutions stick and keep going, that's where collaboration really comes into play, and making sure that there's conversations between philanthropists who are funding these solutions and healthcare workers who are delivering the care, and research organizations that are tracking the outcomes and tracking the results. And so if everyone can kind of work together, I think we could see a lot of change.
I love that. And I know we have about a minute out, so I wanted to ask you one quick final question. Really wanted to get your take on what do you see as kind of the role of technology in some of the programs that you're seeing, and kind of just really so curious about your specific perspective at Merck. What are you kind of seeing as the role of technology moving forward?
Definitely. And this is something I'm really excited about. I think, right now with the emergence of so many tools and, data collection platforms and analytics platforms, we're really able to collect more data on what's happening. And then we can parse through it and understand what the results are and what are the outcomes. And so to me, I think this is a way for us to really, be better at gap identification, and then also better at understanding which solutions really work. And so I'm excited for tools that can help us to kind of more efficiently address areas that need more resources, and see what impact that those have.